Okay, Dr. Gambarin. I know I'm not saying your name right. Gambarin. Okay, you'll allow me to mispronounce your name, right?
Sure.
Okay. It's now September 1, 2010, and this puts us about 2 years after your ketamine coma. And one of the first things we want to start out with is just looking at your function. And before we do that, I do want to comment. We did your pain thresholds just a while ago. And 8 months ago, we did them. And you've made significant improvement, especially in that upper extremity of yours. You know, as you know, this all started on your right upper extremity.
Left.
Oh, I'm sorry. You're right. I'm pointing to your left, but I'm saying right. In your left upper extremity. And then spread virtually everywhere in your body, both the upper extremities, the legs, and then including your face. You have pretty severe allodynia in your face, okay? So let's go through the exercises, and then we're going to get into a little interim history, what's happened with you, okay?
Okay.
So let's start with taking that right hand behind your head, please. Are you having any pain when you do that?
No.
Okay, take your left hand behind you. And you have any pain when you do that? Okay, good. And you might remember back in January, there was a little discomfort, maybe a little burning sensation in your hand back then.
Flying on planes tends to exacerbate.
Right, yeah, right, that's right. Flying in planes, the barometric pressure and all that can really wreak havoc. Now, the other thing we want you to do now is we want to do the vertical finger test, please. See what you got. You got that? Yeah? You have any pain when you do that? Okay. Okay. And the other thing we want you to do is take your right hand out in front of you. Open and close as fast as you can. That's it. Good. Over here, do the same thing.
It's a little harder because I got these
cysts
in my joints.
Right. Okay. Now, the next thing we're going to do here is, I know you don't have the allodynia, but just show us you can touch your face, okay? There you go. Because that was a pretty big deal back.
Touch my arms.
Yeah, you can touch your arms. Yeah, you can do all that stuff now. And the next thing we want to do is turn our attention down to your legs. And I want you to take your right leg off the ground and go ahead and rotate your ankle for me, please. Atta girl. Wiggle your toes for me. Good girl. Hitchhike back to Austin, Texas. Very good. Okay, over here, do the same thing. Good girl. Wiggle your toes. Hitchhike on back to Austin, Texas. Very good. Excellent. Now, next thing we want to do is we want to see how you can get up from the chair. Walk over toward the door, please. Atta girl. And just walk toward me like you normally walk. Okay. Walk on back, please. All right. And go ahead and tell me if you had any pain when you did that.
No.
Okay. Now I want you to take 3 good steps on your toes toward me and 3 steps back on your toes. Good girl. Go on back. Good. Did you have any pain when you did that? You remember now, you couldn't even do that before the ketamine coma. Okay, walk on your heels. There you go. There you go. Go on back. Very good. All right. Good. Okay, and go ahead and sit down. Now we're going to go over some important stuff with you. Now, this is your last evaluation officially within the study, 2 years after the coma. And so let's go back and look at how things went for you. You know, it has not been exactly a cakewalk, has it?
No, it hasn't.
So I think people need to understand. First of all, let me just make this announcement: you're going back to practicing medicine, isn't that?
I am.
Isn't that
I'm
great?
Going back within
I bet
the
you
next
miss it,
couple
huh?
months. I do.
Yeah. Well, we need infectious disease doctors. You know, that's a very important, very important field. But what I want you to do now is I want you to kind of highlight for us, again, the bumps that were in the road along the way, and including a fracture in that left leg and so forth and so on, and then how you managed to climb out of those bumps in the road along the way.
Well, as you said, it's been a long road since the coma. You know, just the coma itself, I developed such weakness. It was about 8 weeks in a wheelchair after the coma until I could really stand up and even walk on my own. There have been several, small complications and a few major complications that I've had, the worst of which was when I ended up in the hospital for a week, having broken 2 bones in my leg by just essentially walking on them. I broke the tibia and the talus clear through, and ended up with some cellulitis on my right foot from a blister, and some pneumonia and a bad medicine reaction to some Lyrica, all at the same time. But I've had lots of little bumps in the road where, like I got a Pneumovax shot, and I had my arm, within a day blow up to 3 times its size, and very red all around. Anybody but an infectious disease doctor would look infected.
But it wasn't. It was just RSD. Just the RSD and swelling and inflammation.
In fact, I have to wonder back in that hospitalization if that cellulitis I had in my foot was actually RSD or whether it was truly cellulitis in retrospect. I've had my port clot off and had to have that replaced, and again I ended up with redness probably about to here.
Right, and there's your port.
Within a day, and
Right.
and it wasn't infected at all. My port healed fine. But again, during those periods, it's severe pain. Nobody can come near me. You touch the bed, and I'd cry out in pain. And during those periods, I had to go back on narcotics. Had to stop my exercise. And the pain from the RSD is so severe that it just absolutely drains you mentally, and almost to the point of just wanting to die.
Right.
And I mean, in fact, I have wanted to die.
Right. Right.
Well,
I want to interrupt you just for a second here, because I think you're making some important take-home messages. And one is that although we don't want patients, if at all possible, to be on narcotics, opioids specifically, to treat CRPS, because it's not very effective. But when you have an episode like injury due to surgery, injury due to a fracture in a leg, you have to take it, because if you don't, tell us what happens.
Well, the allodynia comes back and it spreads, and for me, it spreads to the whole body. And in my case, that also involves my voice. I lose my voice. I can't swallow. I will choke on scrambled eggs or just water, and I just get miserable. I need lots of ketamine to get me out.
Right, and that's another take-home message. The ketamine boosters, and in your particular case, you're what we call a very, very what? Go ahead.
I'm a very tolerant person.
No, you're very expensive. You're a very expensive date.
No, don't say that.
Yes, you are. 400 milligrams of ketamine an hour is what it takes to get you knocked out, right?
Yeah, well.
Adequately cognitively dysfunctional to get the benefits of ketamine. And you do this over 3 days, and you've learned 3 days is better than 1 day,
right.
Correct? And in some patients, they actually need 4 days in order to do the job. And so you're up to 400 milligrams an hour, which is a pretty high dose, but you require it because you're an expensive date.
Well, I'm on so many medications for my pituitary having failed, blood pressure medicines, and all of that.
Exactly. And the point is that everybody is different. It has to be tailored to the individual. It's not there's no cookbook in giving these ketamine. We call them boosters, but these ketamine outpatient infusions is what we should call them. Okay. Mm-hmm. Now. You can attest to the fact that these things that are associated with diffuse generalized CRPS, such as difficulty swallowing, difficulty with your voice, all those things are reversible with ketamine. Mm-hmm. Okay, so you're a living example of that, and we do expect as time goes on you'll need less and less of the ketamine infusions. And tell us how important the heated pool exercises, the exercises to your rehabilitation.
Oh, the exercise makes all the difference in the world. Yeah. Part of the depression when I have severe pain is having to stop for a while and take a break.
Right.
I had so much atrophy of my muscles from having the RSD for so long. It takes nothing for me to pull a muscle or break a bone or whatever, and I have to start so slowly and work up each time, and every time I have a complication, it's like starting from ground zero again.
Right.
But I've gotten up to doing 10 miles of walk aerobics a day, and
that's huge.
But then again, the weather might change, and the next day, I might be at 3 miles, and I'm exhausted and hurting all over. So it's very variable.
So you're getting occasionally you get a bad hangover, but you want to get good hangers.
For the most part, I have many more good days than I do bad days now.
Gotcha.
So
let's turn to your dad over here. I mean, you've lived through this whole thing, and we talked to you back in January. Tell us how things have progressed since you were here in January.
Well, it's just been sort of up and down, 2 steps forward, 1 step back with the complications and things.
Right.
I was hoping maybe she'd be more off the need for the ketamine boosters, but they certainly do make a difference. Once she's had the boosters or whatnot, she's sort of back to normal in most ways. So it's just great that we've been able to find something to give her a life back. So.
Gotcha. Yeah, we have 2 of our research associates here. Karen, do you have any questions?
No.
Tabby, any questions?
Not at the moment.
Not at the moment? Okay, you reserve the right?
I would like to comment on one more thing, and that's
sure.
The depression and the anxiety that goes along with having this, because it's so stressful. Not only just because you're in pain and wondering if it's ever going to stop, and or if it's going to come back when you don't have the pain. But the stress that it puts on worrying about your family and how your family's handling it, and your children, and how your children are handling it. I know my daughter's asked me several times, am I going to die from this? Right. And when you have a relapse, it's so important to just kind of close your eyes and remember that, yesterday you were out gardening or playing tennis, or, able to walk the dogs, or do things that you enjoyed, and that those times will come again after you get some ketamine and get back on track.
Right. Okay, now that's great. Now, this is, like I say, this is your last day in the study, so just kind of in summary, tell us what you would advise anybody contemplating this in terms of an approach, in terms of attitude.
Well, it's definitely a big step. It's not you're going to get a coma, wake up, feel great, and go home. It's a long...
Or do backflips.
Do backflips. No, it's a long road.
Yeah.
I mean, the coma's hard.
Yeah.
It's hard on your body. It's hard on you mentally. And it's going to be a long road to recovery, and there's going to be lots of little bumps in the road, lots of little complications, and lots of times when the pain is going to come back, and you just got to kind of take a step back and go forward again. And I think attitude is extremely important. You need to keep a really positive attitude and really concentrate on the rehabilitation that goes along with it. Every time I've had a complication, the first thing I'm thinking about is, when can I start rehabbing again? And I always get accused of overdoing it, but that's just me.
Yeah. Well, you mentioned the exercise tolerance. You want to exercise, of course, but if you're sore afterwards, that's okay, but you don't want to be hung up for 3 days. Now that's a bad hangover.
Right.
Okay. So I think that's a very good, very important take-home message. Great. Thank you very much.
You're welcome.